Hello guys, hope I'm audible and visible. So this is just an Ask Me Anything session because there have been quite a few queries about what to do in the postgraduate residency. And I also will take care of, there are lots of queries around the app, right? So I have a pathology postgraduate app and how to make the best use of it in your 3 years of residency and how to use it as for a pathologist as well. So I want to go with the first half of the today's question discussion here. The opportunities available in pathology for students who are aspiring to pick up pathology in the upcoming NEET counseling. I'm sure we are not sure when the counseling will be, and we'll be waiting for the government's approval for the same. So I would say both the pros and the cons of it. The biggest con I feel of taking pathology as a field of medicine is you won't have an interaction with the patients. That is there for sure. Like you will not be able to see a patient at least during the life period of the study. No one is going to stop you from seeing patients outside. You can definitely practice because an MBBS doctor is enough to a degree is enough to practice, right? So the first and the biggest con I see that if you're a person who wanted to treat cases, who wanted to see cases, who want to diagnose them and have the intervention done, pathology is not the field of choice. Having said that, quite a few of us take pathology as an like I don't get what I wanted. I have tried for 2 3 years. Can I take pathology? Again, I would say if it's financial constraints, if it's lots of constraints there for you, more than happy. Please go and take pathology. Right. The pros of pathology is uh, over the past few years there have been lots of emphasis on the work-life balance. Right. That's one thing you can perfectly get in pathology. Right. Hi Satyam. Thank you. So the amount of money you can earn in pathology, this is one of the common questions which gets from me. Like there are two things which I want to discuss before going into the money into pathology, right? Whatever field of medicine you take, be it surgery, be it medicine, be it radiology, anything, as a doctor, your earning potential will have a plateau. Beyond that plateau, if you want to go, you have to involve in administration or business. Please understand. If you are anything like if you're just going to do your job as a doctor and not going to care about the revenue, your earning will be sealed. That is how medicine is there as of now in our country as well as in the world, right? At the same time, when you take pathology, like I said, if you're just going to be hardcore pathologist not involved in the administration, you're not much of value for a hospital, right? That's a very fair enough thing. You don't contribute much to the hospital. At the same time, if you're saying that I am a pathologist, I can take care of this lab, I can make sure that revenue of the hospital increases. Your earning will also increase. Like I said, that pathology, the earning potential becomes multifold increase when you go into administration and into business. Having said that, it's not always you have to invest money to open a lab. Like I said, it's administration. The top of the head of the most of the corporate hospitals and lab earn in like easily around 50 60 lakhs per year. When I say head, right? So because they are involved in the lab management, they're involved in the administration, everything. So to go to that level in pathology, it's a bit easier to climb to that level. One, you should have expertise in your subject. That is important throughout the career. Unless you don't have expertise, you are just going to be an administrator. They're not going to take for your role. You are good at the subject. You are good at the diagnosis. In additional, you have a perfect administrative skill to run a lab, to make it functional on a day-to-day basis, to have a plan for the future. You will definitely be much more valuable to an hospital than just being a pathologist. So the period of years you have to develop the skill set if you want to earn more. But like I said, if you're just going to be a pathologist, right? You can earn the starting salary for any pathologist in most of the metropolitan cities somewhere around 80 to 90,000 rupees per month. Just go morning 9. It's mostly an 8 to 8.5 hours job. That's all. So beyond that, you can go to a clinic, you can go to a second lab, you can do whatever you want. But if you want to stay at home, you can stay at home as well. That's why I said it's about earning is always equal to the amount of time you are okay to dedicate in any specialty. At the same time, if you are able to manage skills, you have the managerial skills, you are able to manage a lab, you can have a good high traction. If you have a pathologist working in a lead hospital, like the pathologist just does pathology, like she's not a good managing person, but she reports amazingly. She gets a ceiling value of 3 lakh rupees per month. Beyond that, it's difficult just as a pathologist to earn in a single place. The same person can also work in the evening for extra money. Same time, the time will be constrained for the family as well. So earning potential with respect to pathology, just to summarize them, you need not always invest to earn high money, to have a higher income. You can have just the managerial skill in a lab, in any corporate lab. You can definitely be in the high income strata. But you don't want that. You just want to be a pathologist. You will have a ceiling in a career somewhere around 2.5 to 3 lakhs per month. Beyond that, just as a pathologist, not doing anything else is a bit difficult. Okay. Dr. Hawkins, when I come to job hospitals for pathologists in government hospitals, right? See, I would say that it's not just pathologists. Like I'll take the state of Tamil Nadu, for example, because I know a little bit more about that than the other states, right? Tamil Nadu has a very limited vacancies available for any specialty on a permanent basis. They take for contractual basis. Most of them are filled by MBBS students. And when I open a new government medical college, yes, they do have some openings. That's all. Having said that, when I look at India as a perspective, AIMS is one opportunity which is knocking the doors everywhere. Like you have multiple opportunities because AIMS has been opened in every state and hopefully multiple, more than one AIMS in one state also. That's a vision of of a government, right? So that there are also opportunities available. In one of the region AIMS open, I have two of my colleagues who was junior to me in Jimma is working. So that opportunity is available for now, and over the time, that also opportunity might increase a little bit, and that also will get saturated. The only reason why government is not able to open multiple options is, let's say I'm having a government college hospital, maximum at full capacity, I need somewhere around 7 8 pathologists. That's all. So once I hit the ceiling point, I don't have any requirements unless I open a new government college hospital. At least in government hospitals, the MD pathologist opportunities are less. It's not just for pathologists, surgeons, same. I can run an entire surgery department in a government tertiary care hospital with if it's half, not like an primary. I'm not talking about if it's Tamil Nadu, I'm not talking about MMC or Delhi MAMC. In any peripheral government college hospital, I can run an entire surgical department with two units, two assistant professor, one associate, one professor, HOD. That's enough. So it's easy to manage an entire thing, not clinical, paraclinical, everything with a limited number of staffs. And that will not be increasing unless I open a new college or that capacity of the hospital is going to increase. That's the reason you find less opportunities in government, not just for pathology, for every subject for that matter. Fine. Okay. So coming back to the next. So what quite a few of students think is, Shruti, I'll take a question soon. What quite a few students think is that pathology is a bit easy because it's about Robbins only, right? Because I have read about Robbins in my undergraduate days. I'm not telling this to scare you. Pathology has a very, very steep learning curve. I always feel that pathology humbles me a lot. Every time I read something, something new pops up under the microscope. You have to learn again, right? So if you want to become successful pathologist, you have to be very, very strong in academics. And it's a consistent process every day. Every 4 years, every system WH has minor changes. To be in the top 1% of the pathologists, which all of you guys aim for, you have to be constantly updated, right? I'm trying to do, I'm creating an app hopefully in future that will be a one-stop solution for all the pathologists who's in practice, right? That's the only thing. If you're going to take pathology, be ready to learn lots of books, be ready to learn articles, be ready to learn updates. But like I said, it's very, very humbling and very, very interesting because it's not always the same. You find something new every other day, right? That it's a bit exciting and that's a bit interesting as well. Okay, Shruti, like I said in the start as well, if I want to be practicing as a duty medical officer, you can practice with the MBBS degree itself. No one is going to say that you should not practice without with an MD pathology. You can practice obviously. You have an MBBS degree, you can practice obviously. Uh, I am not sure if I can say this. There are in our country there are lots of people without an MBBS degree who are practicing and are flourishing well, right? So it's about the confidence which they have. In 3 years of MD pathology, if you're losing your clinical skill, I would say that will be a bit difficult to revive. So if your goal is to make sure you want to practice also post MD pathology, I would say do the routine practice during the residency also. I know it's difficult, it's definitely difficult, but if you can do that during the residency also, that will be the amazing thing so that you keep in touch, you keep updating yourself, and definitely you can practice. There's no harm that no one is going to restrict you to from treating patients. No one can do that, right? Okay, Dr. Hawkins, another question like, can you go to the research field after MD pathology? See, research is always good in basic sciences. It's a bit difficult when you go higher up into the clinical, like because the opportunities also kind of reduce a little bit. Definitely, there's huge scope of research in pathology, but for an amazing research, worthwhile to take care of your family financially as well as interesting research, original research, you have to go abroad. Unfortunately, India does not have excellent opportunities for research, and there are few places where there are opportunities for research, but there are lots and lots of pressure, lots and lots of influence required to go into the places. Like I said, if you wanted to go into research, pathology is definitely an amazing thing. Go abroad. US, UK are the best, obviously. Australia is also the best, obviously, right? So these are countries which welcome people for research. You can definitely go for research because it's medicine, and genetics is being a part of pathology these days. It's everything is becoming genetic over the period of years, right? So definitely there's huge scope of research. You can definitely go into it, right? So since I took the other thing, genetics. So what all a pathologist can do in a real time when once you come outside. See, there are multiple verticals in pathology. One is hematology. Quite a few of them love hematology because it's one which most of your teachers will like, and one you have requirement in the outside as well. In hemat, I have peripheral smears, I have bone marrow, I have your flow cytometry, I have genetics, lymph node, everything. So there is DM hematopathology as well. Then I have histopathology. There's DM histopathology as well. There's DM oncopathology only for cancers. In histopathology, it takes care of almost everything neoplastic as well as non-neoplastic. Everything which is under the sky in biopsies will come under histopathology. Then I have cytopathology, which takes care of FNAC pap smear. Generally, a job of a cytopathologist, because there are fellowships for cytopathology, which is not much available in the private sector. If you go to an institute, you will have job opportunities for particularly for cytopathologists, not in the private sector. In the private sector, FNACs are considered a bit inferior. Everyone goes for biopsy for much more clarity in the diagnosis. And then you have genetics. In genetics, you have cytogenetics, which has fish karyotyping, molecular genetics, PCR, real-time PCR, MLPA, and NGS and everything, right? So all these are the verticals of pathology. Please understand one thing. If you have to be excelling in something, you cannot excel in all these verticals. Choose one and do that consistently, you can excel. Like I said, there are DMs available in hematology, hematopathology. There's DM available in your histopathology, oncopathology, neuropathology, and there are lots of fellowships for most of the organs you name. So take your niche, do it consistently, and fit in your hospital wherever you're going to work, and then grow yourself. That will be the best way to going forward. If you have interest in something, please go ahead and go the interest. Fine. Thank you, Dr. Hawkins. Top 29. See, FRC path. See, there are two things. Like, I would take it with a pinch of salt. See, FRC path has not one step. Most of the FRC path people who clear FRC path, whom I know is they clear the first step, which is the MCQ part. You have the second step, which you have to go to UK and write there. So once you clear the entire FRC path, you are eligible to report in the UK. If you have FRC path, you are eligible to report in the Gulf. I would say if you are really interested in FRC path, I don't know why you want to come back to India. You have better lifestyle, better living opportunity, better work timings, better economics, better finances, everything abroad, right? So if you want to do FRC path, if you have to take that career path, I would say please go abroad, stay abroad. Coming back to your question, once you come back or if you want to come back to India, FRC path definitely has a weightage. But looking from a private lab person, I would say FRC path also comes with a problem. You work in foreign countries for 10 years, you come back to India, you expect the same thing to be in India. That's not available in our country. So the people who are worked FRC path in foreign, for them to come back and settle and adapt in an Indian lab environment is a bit difficult. You can fit in a very big corporate chain, which will give you all the comfort. You cannot fit into a second tier city, second tier hospital at all. Right? But yes, FRC path if you complete, there's definitely huge amount of at least a little bit of extra income and extra expertise in the lab head portion they can give you. But it always takes a pinch of salt. If you want to write a FRC path, please complete both because that's more valuable than complete this step one alone. Right? Okay. So I have floated a Google form to all the existing pathologists in the WhatsApp groups who are there. And the Telegram group link is also below. You can join that. That's exclusively for pathology residents all over the country. I'll show the form again. The form will have few inputs about the case load, what they have. Do they have the infrastructure for IHCs, flow cytometry, genetics? And once it's ready, I have close to 60, 70 colleges already. Once everything is ready, I'll definitely give it to you guys so that you will have a very planned decision of what college to take, what not college to take. Because this is again the next query which comes to me. Primarily, my order of choice, if I have to fill the choice now, I would say that uh, first tier government college hospital in every state, like in Tamil Nadu MMC, in Delhi MAMC, those things like MAMC, UCMS, LHMC first. Next, I would prefer a very good DNB, like in Apollo, like in Stevens in Delhi, very good in DNB. Then I would prefer a peripheral medical college, even if it's a government college hospital, right? I'll do that. So that will be the order of choice for me to choose. First an MD in a very good government college, AIMS or any good government college. Then I would go with your DNB in a very good institute, a first tier institute, and then a peripheral medical college, or peripheral government medical college or private medical college. If you have a private medical college like Manipal, I would put it up along with the first tier, the best of the government colleges. Manipal, Ramachandra of Chennai, everything are amazing. The amount of load of cases they have, the variety of investigation they are definitely can be equated to MMC of Chennai and Bangalore Medical College of Karnataka. Fine. Okay. Doctor name, one more question. Is DM better or fellowship better in pathology? See, I would leave it to you. Personal opinion, if you ask me, I need expertise in reporting. Let's take histopathology or oncopathology for that example. I need expertise in reporting pathology. Slide, that's all. If I know the knack of reporting, the protocol of reporting, that is enough for me. The degree is just an additional thing. If I'm having confidence in reporting any damn tumor in the body, doesn't matter. You will definitely make your way. Fellowships of 1 or 2 years, I feel is a bit more comfortable because thesis will not be there, not much of thesis will be there, pressure will not be there. You can finish freely and come outside. DM has 3 years, but as of now, DM doesn't have an extra value compared to fellowship. I cannot predict future if DM degree is going to be given much more value. I am not be able to predict it. But as of now, if you have a fellow, that's much comfortable and much faster to finish, and you will be put into the real time much earlier. So I would say my take will be fellowship better than DM. Fine. Kim, it's not that FRC path is the requirement in Gulf countries. There are Gulf countries which have multiple things. Like if you want to work in Gulf, they take, if you have an MD pathologist in India and the 3 years of experience as a pathologist, they consider yourself a specialist. Then you have something called the DHA licensing exam. You'll have to give a DHA licensing exam and then you'll be eligible to work in the Gulf countries. Again, like I said, different Gulf countries have different rule, different sorts of exams. But if you finish FRC path, you're like directly eligible. You might not require to give the licensing exam. That's all. Otherwise, I have to give the exam. An exam is not difficult to pass. It's a very simple exam to pass. But you have to do that if you have an MD pathology degree. And as a fresher, they don't encourage you. At least minimum 3 years of experience they would require. That makes you as a specialist. Rather than generalist, if you go into specialist in a Gulf country, you will have a better portion of opportunities and you will be paid more as well. Fine. Okay. Thank you, Dr. Nine. Dr. Nine. Fine. So I think I have tried to cover whatever has been asked for me till now. Like what are the opportunities available? What are the diversifications possible? What college to choose? And like I said, I will soon put a list of colleges with the exact infrastructural material available from the current MD pathologists of their colleges, so that you will have an informed choice to go ahead and study there, right? So there is a link to the app which I have that's particularly only for pathologists, and I hope I'll start a blog soon where I can get all your inputs and will make the learning of pathology the best way possible. Fine. And there's a dedicated WhatsApp and Telegram group. You can join the Telegram group and let's learn pathology more together. Dr. Hawkins, NIMS, does NIMS have MD or DNB? Because I am not yet perfectly aligned to the latest development, so I might lack that. KM versus NIMS, I would say both are decent because NIMS has few advantages. Like NIMS is very, very good in like renal pathology. So they have fellowships in renal pathology. So few areas NIMS is superior. KM is superior in few areas. KM has an extremely lung and thoracic pathology unit. KM is very, very good in autopsies. KM is very, very good in basic things. And the volume of load in KM is definitely more than in NIMS Hyderabad. So the way wise, ranking wise, I would put KEM as well as NIMS in the same place. Maybe Topiwala a little bit lesser than them. So if you're opting for anything, so go with your home state or go with the comfort, whichever it is. Because NIMS as well as KM, I don't have a drastic difference in the quality of it. That's all. Fine. Sure, Dr. Indian. I will put the listing of the colleges soon in the Telegram group. Fine. Okay. So thank you very much, guys, for your time. It is a very short session, and I'll definitely be coming up live soon, and we'll discuss, learn more pathology, the way to report, the way to look at slides, and everything. Komal Rao, clinical hematology DM is where I can, if you're a pathologist, you can go ahead and give a clinical hematology DM for now, DNB clinical hematology and your DM clinical hematology. But that's a very changing scenario. Like one time they said that you cannot give, the next time they said you can give. So I have to wait for every NEET SS prospectus to see if a pathologist is eligible to do that or not. Fine. Okay. So if there are no more problems, no more queries, I think I will stop it for now. So we will learn more together. Like I said, I will definitely come live and we'll learn more cases, the way to report. We'll definitely make sure pathology learning is much more easier and much more comfortable. Thank you guys. Thank you for your time. See you soon. Bye bye.